Axial Spondyloarthritis Playbook: Reducing Time to Diagnosis and Improving Patient Experience. Patient and Public Involvement in Quality Improvement. It's essential to involve people living with axial SpA at all stages of quality improvement projects, and there are various ways to do this. Points 7 and 8 in the Axial Spondyloarthritis Playbook cover patient and public involvement. The Healthcare Quality Improvement Partnership states that when done properly with true co-production, engaging people with lived experience in service improvement has huge benefits, including enhancing healthcare improvement by prioritizing what matters to patients. It's important to include them right from the beginning before a project has even taken shape to make sure you're addressing the right areas to improve. Including diverse perspectives and helping tackle health inequalities. Strengthening transparency and inclusivity within the healthcare system, which benefits staff as well as patients. Learning and evolving. People with axial SpA aren't just people with axial SpA. Service users bring their wide-ranging and valuable skills as well as lived experience. And working together is better for staff too and can build a supportive and collaborative community. There are lots of different ways to involve people living with the condition. Your hospital or trust may have a formal PPI group which you can utilise. Questionnaires and surveys are a useful way to get feedback from a broad group of people. It's important to involve people with axial SpA in the survey design and development. Focus groups and engagement events can be valuable, but often the most proactive and engaged patients are reached this way, so it's helpful to combine this with other methods to ensure you're getting a range of perspectives. For example, collaborating with community networks to reach people who are usually less involved or face structural barriers to being involved. Smaller, time-limited working groups can be helpful for specific projects or areas within a larger project. And it's vital to feedback the impact of this patient involvement to those who have given their time, expertise, and emotional labour. Within the playbook, we have links to guidance around co-designing projects and public involvement. But now for a couple of practical examples. Firstly, Belfast Health and Social Care Trust physiotherapists worked on a project to enhance patient care and tailor the axial SpA service to meet the needs of patients. They worked with the patient involvement team within the trust to design a questionnaire in collaboration with consultants, physiotherapists, and managers. The questionnaire was sent to a reader panel for wording and format improvements, which proved beneficial as it made the questionnaire clearer and more concise. The questionnaire was then circulated in a number of ways to maximise the reach to patients. In clinics, patients could respond in person or via a QR code for digital responses. It was shared in clinic letters as well as speaking to patients directly. The questionnaire was sent to 110 people and received 27 responses. The results highlighted that effective communication surrounding their new diagnosis of axial SpA is essential. Only 55% of respondents felt they could fully understand the information provided to them at the time of their diagnosis. The results also showed that a one-size-fits-all approach is unsuitable. Patient choice is important, as people prefer receiving information in different ways. An unforeseen piece of feedback was that patients felt the wider multidisciplinary team could have made them more aware of the physiotherapy service. This highlighted a need for education among colleagues. The team's next steps are to run focus groups so patients can share their views in more detail. Another example is the Royal Berkshire NHS Foundation Trust, who wanted to investigate what patients wanted to discuss prior to their clinic attendance and to explore if these topics were discussed by the clinician. This aimed to review discrepancies between patient and healthcare professional goals so they could put in place steps to bridge the gap. 130 patients were sent a pre-clinic questionnaire asking what they wished to discuss at their appointment and what goals they wanted to achieve following treatment. Questionnaires were collected before the appointment, and then medical notes and clinic letters were reviewed after clinic to check if the questions patients wanted to cover were discussed. 77% of patients returned the questionnaire. The healthcare professionals involved were a similar split, with 38% seen by a doctor, 32% a specialist nurse, and 30% a physiotherapist. For the first question, the top 3 topics patients wanted to discuss were medication, pain management, and disease progression. Regarding the second question, the top 3 goals held by patients were to be pain-free, to maintain flexibility, and to be mobile and active. Other goals focused on fatigue, sleep, infections, and family planning. The analysis of medical notes and clinic letters found that patients' topics were discussed directly by the healthcare professional in 73% of cases, and patient goals were discussed in 59% of cases. It found there was a degree of discordance in patient and healthcare professional goals. As a result of this work, healthcare professionals now focus on the top topics. They've updated their axial SPA pathway to include these and developed educational content for clinicians. So you can see that there are lots of ways to involve patients in your quality improvement projects, and there's huge benefit to it. The key takeaways are that patient involvement in service improvement isn't a nice to have, it's essential. And meaningful, well thought out involvement can bring benefits to individual patients, staff, and the whole service. As we explored earlier, there are lots of different ways to involve patients. Remember to consider why you're involving patients, who you'd like to involve, and how best to involve them. And it must be early on in the project and address any systemic barriers to engagement. It's important to share our methods and learning to develop patient involvement in service improvement and help other projects in turn. But don't forget, NAS are here to support you. And finally, we'll end with the quote that is important for patients and the disability community as a whole. When looking at anything that will affect people living with the condition, remember, nothing about us without us. For more information, support, or to have a chat about how we can help you with PPI, please email goldstandard@nas.co.uk.